If you've ever had frothy spit come up after eating, almost like you're going to vomit, but it's just foam, you're not crazy. It's real. It's called Foamies. Stay right here. Gail, Isabel, and I are breaking down exactly what they are, why they happen after bariatric surgery, and how to make the foamies stop.
Say goodbye to chalky calcium chews. ProCare Health makes chews that are creamy, not gritty, and packed with food-based TrueCal for superior absorption. Now available in peaches and cream. And yes, it tastes as good as it sounds. Save 10% with code BSS10 at ProCareNow.com.
I'm bariatric dietitian Dr. Susan Mitchell. You're listening to the Bariatric Surgery Success Podcast. I'm so glad you're here today. It matters where you get your nutrition information. Here's what you need to know now. Joining me today are your favorite expert bariatric dietitians, Isabel and Gail. In their clinical practices, they have their fingers on the pulse of the most up-to-date nutrition information. Isabel Maples is a bariatric coordinator at UVA Health in Haymarket, Virginia. Gail Smith is a bariatric dietitian at the Weight Loss and Bariatric Surgery Institute in Orlando, Florida. You can find both Isabel's and Gail's contact information in the show note. Hello, Isabel and Gail.
Hi. Hi, how are you doing?
Well, Foamies. It sounds like such a funny name.
It's
But
cute.
and you think Foamies, but if you have them, they are not funny at all. Foamies happen when this frothy, foamy saliva comes up after eating, usually something that your stomach doesn't like. It's not reflux, it's not vomiting, but though it feels like you're going to throw up, but instead of food or acid, you get this thick, bubbly saliva. It's uncomfortable. It may include some burping or chest pressure or nausea. And these foamies are often seen in gastric bypass and sleeve gastrectomy, which you both see a lot. So why, Isabel, do foamies happen?
Well, first, remember that your stomach is smaller after surgery, but also from bite to belly and beyond is not a straight line in your digestive system. And so there's some turns and curves. And if you are not slowing it down, eating slowly, chewing your food, pulverizing your food to the texture of applesauce initially, then something might get stuck. And that's not uncomfortable. Well, saliva is going to increase to try to help with that obstruction, to help move it on and get and digest it. And it gets aerated and it's becomes this kind of mess that really is not going to let your stomach signal fullness. It's just going to be this uncomfortableness, especially when it comes back up.
Okay. I had a question from someone who had eaten a veggie burger with sugar-free honey mustard. She'd done all the right things, chewed each bite really well. She'd taken 30 minutes to eat, but she kept getting terrible pain and hours of foamies. Now, don't miss this because this is important. Her foamies became daily. She tried eliminating foods that might be a factor, but the foamies didn't go away.
Red flag. If there is any time there is pain, pain is never good. And foamies shouldn't really last that long. Okay. This is very much an unusual case. And I make sure that patients know if this happens to you, you've got to contact your surgeon's office. A lot of times we give the patients a special number to call if there's any issues to put them right in contact with the surgeon on call. There may be a problem going on. There may be a blockage. There may be a hernia, and they really need to see you really soon.
And you're exactly right. And in this case, there was a blockage that had to be taken care of. That severe ongoing pain, like you just said, was a clear sign that something wasn't right. Now let's talk prevention. So if possible, this worst case scenario never happens. What should your bariatric diet look like to prevent foamies?
Well, each program is going to have a little bit different transition, but in general, you go from liquids to kind of a mushy texture to soft and back to regular texture foods. And during that process, there is some time frames and some rules in place that your bariatric dietitian will give you, all designed to make you as comfortable as possible. So, for instance, one of the things that's easy to get stuck is like dry pieces of meat or bread because it can kind of squish up. Think Wonder Bread and you squish it in your hand like that. Or maybe, and then it's this big block. Or overcooked eggs might even,
Oh, yeah.
initially, and they can kind of clump up and block the stomach because, again, it's not a straight line there. There's some curves in
Yeah.
there. And so, what you need to do first, I mean, besides slowing down and eating slowly, is remember that you're going to use moist proteins. And especially at the beginning,
That's a great tip.
I mean, at the
Mhm.
beginning, that's going to be tuna. It's not just going to be tuna. It's going to be mixed with mayonnaise or some yogurt or light yogurt or whatever you like them there, or canned chicken the same way. Soft scrambled eggs, cottage cheese, even deli meat, chicken or turkey are good places to start. So that you can chew it up easily and it's
Mhm.
moist and it goes down and doesn't feel like it gets stuck. Or it doesn't
Yeah.
actually get stuck.
Yeah, and speaking of getting stuck, it's important that their foods are moist, but also the 30-30 rule, which means you don't drink when you get to phase 3, I say, more of the soft foods. Like phases 1 and 2 in our clinic are clear liquid, full liquid. Everything's liquid. But when
Yeah.
you get to soft food, you cannot drink and eat at the same time. Or guess what? And everybody tells me, all the patients tell me that they can feel the food starting to come up. You're going to throw
Mhm.
up. Why? There's only 4 ounces of space in there. And you put
Yeah.
your food in, your water in, boom, it's coming up. Now, the throw ups don't last forever, but you wish you could at about 4 months, 6 months. You don't throw up anymore, but you try to drink and eat at the same time, you
Yeah.
get the worst feeling in your stomach. And
I'm really
so,
glad you shared that because we get asked so
mhm,
often, do I
mhm.
really have to separate drinks from food? And here's a good reason why.
Yeah. And it's for life pretty much 30 minutes. Some people say 40 minutes after they eat, then they can start drinking. So it's very important to get into that, scheduling, that routine of always drinking in between your meal, in between your meal
Yeah.
snack, so you get your fluids in, obviously, and to sit up straight and don't lie
Yeah.
down right after you
Yeah.
eat, right?
That's another great point that I think a lot of people probably
Yeah.
don't think
Yeah.
about. Do
And
you guys?
going to say, like, initially you do that for the comfort, but it's really going to set you up for some really good habits later on. And
Yeah, I
that'll
like
help you
that.
with
Absolutely.
weight maintenance too.
Yeah.
Absolutely.
We always want weight maintenance and good habits. Yes, we do.
Mhm. I
So,
always say you think you're hungry, but you're really thirsty, is what I tell people. So you got to be drinking in between.
yeah, absolutely. So, foamies in the beginning, but do you guys see foamies 1 or 2 years down the road?
I don't have people complain about it. I'm not saying it doesn't happen, especially if people haven't adopted those good habits, but it's really at the beginning during that transition, the first year, the first 6 months, where I really get people having more problems. So at least complaints about that.
Okay.
Same here. Same here. Although if they do have it, they know they were, taking 5 minutes to eat their lunch and they ate that half
Mhm.
sandwich too fast, and then it's going to happen. So
Okay.
Yeah.
yeah.
Okay. So let's say that you have foamies right now. You're listening and you're thinking, ooh, I get those foamies. It's maybe too late for prevention right now. So what do you do if you're sitting there now and you're thinking, I've been dealing with this today, yesterday? How do you stop the foamies?
Well, you've got to slow down. And I tell people, take about 20 to 30 minutes to slowly chew, chew, chew to that applesauce consistency before you swallow, and just smaller bites. And just have that time. If you don't have that time, then don't eat a solid food. Drink a shake or drink something liquid with protein in it.
I'm really glad you said that because I know people are going, some days I don't have that. And I'm at work, or
Mhm.
I'm this, or I'm that. So I do like what you just said, that if you can't do it
Mhm.
and you don't want the problems, or you're having the problems now,
Mhm.
switch to a shake during that time. And I know
Yeah.
people say, oh, don't do that. But you got to go with
Yeah.
what works for you at the time.
And I'm really big on letting fullness help dictate how much to eat, what you do. So sometimes I have people eat regular meals. I mean, on the soft food diet during the day, and then they're like in the evening. Oh, I just can't do it. I just can't eat. So that's where a protein shake can work to help meet that
Mhm.
protein need, give you something to eat, keep that pattern of not skipping meals, but you're not as going to be as full. Now,
Okay.
eventually, you want to learn how to eat regular foods. Nobody's going to
Exactly.
want to go out to dinner
Absolutely.
with you 2 years out from surgery, and all you can do is a protein shake. But
No,
eventually,
hmm Well,
absolutely.
I have
And
people
and
call
in the
me.
right portions.
Exactly. And I have people call me and they're afraid to eat because
Yeah.
everything's coming back up. And if you dig deeper and find out why, they're just
Mhm.
eating the wrong foods, too high in fat,
yeah,
too dry, and then they're eating way too big of a bite. So
yeah,
yeah, it is simple stuff, but it's just the process.
So just
and
really like you said right now, if you're dealing with this, whether it's down the road and it's big meals or it's right now with Foamies, it is just taking that step back and go, okay, wait a minute. I need to separate my fluids from my food. I need to go
mhm.
back to these smaller bites, moisten my food. Don't let it be dry or sticky, all of
Uh-huh.
that so that those Foamies calm down.
And what you
Exactly.
don't do is get that drink of water, because a lot of people will say, I want to drink some water to kind of get it all calmed down. That's not what you don't do.
As we wrap up, anything about Foamies that we've missed and you want to share?
Basically, to be careful, be aware, follow our guidelines, listen to your body, and give us a call or get some help if you have issues.
That's
Don't
ex-
wait.
Yeah, that's exactly what I was going to say. If you're having this problem, kind of go back to the basics of bariatric nutrition that we're talking about. But call us, tell us, don't wait. If you've got 2 months before your next nutrition appointment, call us and we can troubleshoot it.
I like that so much. Thanks for coming in today and guiding everyone about Foamies. I really appreciate your time.
You're welcome.
Always good to be
It's
here.
fun.
So here's what I want you to do this week. You just heard Gail and Isabel. If you have Foamies, if you've been dealing with it yesterday, today, try the tips they just shared. Slow down. Moisten your food, small bites, eat very, very, very slowly. Take the time. If you're at work and you don't have that time today, substitute a shake. But if you have pain that persists or Foamies that don't go away, talk to your surgical team. Make that phone call. Don't wait. All right, on a similar note, if you've been dealing with stomach cramps, with sweating, nausea, dumping syndrome, it can completely ruin your day and derail your weight loss. So I'm sharing 4 top tips to stop this unpleasant condition. You'll discover these simple strategies to soothe your stomach and get your day back on track. You can grab the freebie guide right now at breakingdownnutrition.com/dumping because you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories LLC.